Hello, everyone. It's Darlene. I know I'm late. I said I would give a video on skin um, in your baby's first year. Uh, I made a list of things so I don't skip over important topics, but I want to start with the important characteristics of skin. Skin is your baby's first line of protection. Protection against bacteria, protection against irritants, protection for maintaining temperature. Um, and it is important to take good care of it. Uh, Two, your baby's skin is the largest organ of the body. Okay. Um, and that's comparing uh, all of the organs, including cardiovascular, the heart, the kidneys, and so forth. Um, Third, the skin is very thin, and this is very obvious, especially when you have a baby that's born premature. The skin in a premature baby is so thin you can see right through it almost. You can see the blood vessels easily. Um, as the fetus becomes closer to term, the skin is thickened some, but it's still thin compared to the skin of adults. And the other thing that's important to note is that in addition to being thin, it's also underdeveloped. Um, Four, you should know that the skin color at birth will not be the skin color later. Okay. Expect the color of the skin to change regardless of the ethnicity of the child. Initially, the skin can be real ruddy in color, a deep red to a purple in color, and then the skin becomes more pink in color. And you can still have blue coloring of the distal parts like the hands and the feet, especially when cold. Five, the skin is a large surface area compared to body volume, and therefore um, it has a greater absorption capability. So you have to be careful what you put on top of the skin because it will be absorbed into the skin. This, in addition to babies have a high metabolic rate, the two factors together can lead to increased risk of dehydration. So you have to be very careful of fluid status in babies. Six, the skin of newborn babies is prone to rash development, and there are lots of rashes that you can see in babies that are normal findings, especially within the first few months of life. I will not go over rashes in this video, but I think the next video I will do specifically on rashes that are common in newborns, especially the first few months of life. Seven, the skin requires special care. And I'm going to talk about this special care as far as hygiene later in this video. But remember that your baby is doing a lot of salivating. They may have nasal secretions. They're urinating on themselves, and they have feces that they may be um, in contact with. So there is special care that must be undertaken to protect the skin of your newborn. The next area I want to talk about is I'm not sure if anybody remembers or has heard the term Vernix Caseosa. This is that cheesy white uh, biofilm that's on babies when they're born. The earlier they're born, you may see more of this thick coating on them. The closer they are to term or post term, you may see less of it. This cheesy protection has multiple functions. Some of them include antimicrobial properties, protection against bacteria and other things, lubrication in the birth process, um, also temperature regulation, and the last thing is moisturization of the skin. And so previously, what you would see is a baby was born and the vernix was immediately or shortly after birth cleaned from the skin. Nowadays, there are options. Um, Many hospitals are leaving the vernix on for at least the first 24, 48 hours. So they're delaying the first bath. And in some places, they may delay the bath for the first week or so um, to maintain the properties of the vernix. Okay, so the last thing I want to talk about in this video, because I'm trying to keep the video short, that so you're not overwhelmed with too much information. The next thing I want to talk about is how do you take care of the skin? So skin hygiene. Um, in the older days, we used to say bathe your baby every day. However, we now know that the more frequently you bathe the skin, the more likely you are to dry out the skin. Okay. And so, in general, if you're bathing your baby at least 3 times a week, about every 2 to 3 days, and make sure you're using things that are made for babies. A lot of people are using lavender scented or fragranced bathing substances. If you have a family history of allergies, I would avoid lavender because lavender has been associated with histamine release. And so if you have someone who has allergies, even babies can have allergies, you may bring on early expression of these allergies, especially in the skin, such as the onset of early eczema. Okay, since the hair and the nails are extension of the skin, the top layer of the skin, the ectoderm, I want to talk briefly about taking care of that. The hair should be washed probably the same time you wash the body. Um, it's not uncommon that you find people are afraid to wash over the soft spot or the anterior fontanelle of a baby. Please do not be afraid. Unless you're intentionally trying to hurt this area, you will not hurt it. And the most common area for cradle cap or seborrheic dermatitis is over the soft spot. So please, when you shampoo the hair, don't be afraid to wash over the soft spot. Um, and I'll talk about how to take care of seborrheic dermatitis when I talk about skin rashes. As far as nail grooming, the nails are also very thin. So the best time to groom the nails is right after the bath because when the skin gets wet, the nails get wet also. And when the nails get wet, they're easy to peel. You do not have to clip them with a clipper. You don't have to bite them. You just peel them with your fingernail across the baby's fingernail and they will peel easily. Okay. All right. Well, that's the end of this video. Quick video on the skin. And like I said, I think the next video I will do on skin rashes and um, the most common skin rashes you'll see in the first few months of life. And I will talk some about how do you treat the rashes, just briefly, not in great detail. So if you like this video, please give it a thumbs up. If you have questions and you would like to leave a comment, please leave a comment in the comment section. If you've enjoyed this video and you have not already subscribed, please subscribe. And if you would like to know when there are more videos coming out on this topic, your baby's first year, Make sure you hit the bell when you subscribe, and then you will be notified of further videos that will be produced. All right. Thank you for your time.